Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today, I'm here with my long-term plastic surgery buddy, co-host of the Beverly Hills Plastic Surgery Podcast, and associate, Dr. Millicent Rovelo. Dr. Rovelo, how are you doing today?
I'm doing well, and I am all of those things.
You are?
I am.
I was just reading off your resume. That's all. I just wanted to, just get it out there.
Hit the highlights. Because the point of this podcast was actually brought to us by a loyal friend, listener, and scribe. Because she's like, how did you guys meet?
How did this happen? How come you're on billboards?
Yeah, and if you know Kim, that's what she sounds like.
I know. And we do, and we are on billboards, and it is a good question. How did we get here?
How did we get here?
How did you meet your plastic surgeon?
So, how I met you was when I was a USC plastic surgery resident that was sent to your practice my last year of plastic surgery residency to be educated by you. And I actually remember the exact moment that I met you because, when you're residents, you're high strung all the time and you're always worried about making a bad impression and being late and not studying for your cases. And I had never been to the Beverly Hills area for where your office was, and I was trying to find it, and I was so lost. And the previous resident was like, "Oh, you're going to park in this garage, and you're going to walk through this alleyway, and then you're going to cross the street, and then you're going to find the office, and it's behind a hill." And the directions were awful. So I'm walking in circles around Beverly Hills, and I was like, "I'm going to be late on my first day." And then I see you crossing the street on Camden in your scrubs, wearing your monogram J. Calvert scrubs. And I was like, that's Dr. J. Calvert. I was like, Dr. Calvert, Dr. Calvert.
Yeah.
My name is Millicent Rovelo, and I'm the chief resident on your service, and I'm so sorry I'm late. And you were like, I'm going to Creation to get some juice. You want to come with me?
That's pretty much how it goes.
And I was like, oh, yes, please.
Yep, that was it.
And that is how I met your plastic surgeon.
Yeah, and then you were able to, learn stuff while you were on service. And, I remember you were definitely a very knowledgeable resident, for sure. I noticed that immediately. Many of the residents would come over and they didn't, I don't know, I think it was probably your general surgery background, because you were a badass general surgeon before getting into plastic surgery. And that, a lot of people don't know how you become a plastic surgeon. And there's all these, questions about do you have to, do heart surgery first? Do you have to do, bowel surgery first? And there are many ways to get to plastic surgery residency. But you did a very, traditional way of getting there, which is do a full general surgery residency, and then come to USC for the plastic surgery portion, which makes you just double board certified.
Yes.
And, it is there are other ways to get there. You can do orthopedics first. You can do ENT first. You can do
just straight
urology.
plastics.
You can do an integrated plastic surgery program right out of medical school. So there's all different ways to get there. But reality is that when you finished, you did a great job, in your residency. You were an all-star. Obviously, I picked up on that. And that's when you were done. I invited you to kind of hang out in Roxbury and say, look, you can build a practice here. I said, I don't have a job for you, because at the time I really didn't. Hiring somebody is a very big responsibility. Mm-hmm. So I give a lot of credit to the guys and gals who say, I'm gonna hire an associate to work for me, because that means providing them with a salary and with personnel, and you're investing a ton of money into that person. But I did say you could hang out, and that I would help you and teach you and do all that I could to make you the best plastic surgeon possible. And I think, that's when you were able to really rise up in your career, which, you were able to find your hospital-based practice. You were able to find your aesthetics-based practice in Beverly Hills. And the whole time we were, conversing and making, the academia of what we do kind of a priority.
Yeah. I mean, that is how I sort of landed there. Obviously, you already had the practice set up. And when I was finishing my residency, 9 months after I'd first met you, I needed a job. I was coming out. I needed to make money because that's what happens when you
Yes,
finish
you do.
training. You got to make money. And LA is a really hard place to set up shop as a plastic surgeon. There's just so much competition, and there are very, very few practices that will hire you, unless you're working in a university system or, you're doing all the big recon type of stuff. And so I just needed a job. And my program director in my residency directed me to you. He was like, yeah, I don't really know how to help you. I don't, go talk to Jay Calvert. He seems to have his finger on the pulse in this city. I'm like, dear Dr. Calvert, I'd like to talk to you about a potential. And I had no idea what you would say. I just showed up meeting with you and I was like, I don't know what to do. Like, I need to stay in the city. And do you know of anybody or do you know of any places? And you were like, why don't you open up shop here? And I was like, oh, that was not where I was going with this, but that was okay. When can I start? So I hung a shingle and opened up shop in your office, and it worked out really well because and to this day, we still have two totally separate practices. Like from a financial standpoint, they're separate. They don't mingle. We share some of the same personnel and office space. But you have your practice and you run it in a certain way, and I have my practice, and we just happen to be in proximity to each other with some overlap of using the fellows and the facilities and the personnel. And it's worked out really well. I was able to really, build my practice, gain my experience, bring in my patients, all while having, a really trusted, experienced surgeon, who can help me out when I have questions or, have, just support in general.
Yeah, there's a lot to that because, when you get started, you can make a lot of mistakes or you can make a few mistakes. And if you have somebody that you can kind of bounce things off and say, what about this? And somebody can run in the OR and check on, what you're up to. And, and I think really your advancement in, for instance, in facial aesthetics, like that.
Yeah, that was huge.
That's a big deal.
Yeah.
Like you got people flying in for facelifts now. That didn't happen, and you're not, like me, 20 years out of your residency. You're a lot younger than your senior associate here, but you are already very advanced, and especially, I see your patients, I was taking the sutures out of one of your facelift patients and she looked fantastic. She was literally over the moon with her result, and she should be. It is a great facelift, and that is, and you didn't do a aesthetics fellowship. You didn't do any of the things that, kind of get you to where you are now in that amount of time, but just from the relationship that we've had as associates, I think it's huge. And from my standpoint, you've really brought a lot to the table for me in terms of my breast practice, which I do a ton of breast surgery, but the stuff you do, mere mortals will shudder at the stuff that you're doing at your hospital-based practice with your weight loss patients and these people who've had just difficult breast reconstructions, and I've learned a lot from you. So it's a symbiotic relationship in a lot of ways. And then, of course, the podcast came about when I started doing my hockey podcast, and because I love hockey. I don't know if anybody knows that, but
in case our listeners don't know, because we actually don't talk about that on this podcast.
No.
You have like a whole other podcast, by the way.
I do. It is and it's a podcast that anybody listening to this podcast, unless you are a hockey fan, you can't even get through 5 minutes of it.
That's something they probably don't even know because
there's no
not a whole
overlap.
lot of cross population there other than you.
No, but I love hockey. And so I was doing a hockey podcast because that is an interesting story. After the Vegas Golden Knights came to be, I was very I was helpful in assisting the owners of the Vegas Golden Knights in writing their pitch to the NHL, to Gary Bettman, and sort of what they were doing early on, because they weren't really hockey people. They were more basketball people. And after they got the team and things were going great and they were selling tickets left and right, my friend was like, you need to do something with your hockey knowledge. So I started podcasting because I didn't know what else to do. And then I got called by the owner of Podcast One to come in. And so that's when Dr. Hockey came to be. And as I was doing Dr. Hockey, I was like, I have to take some real estate in the plastic surgery podcast world. If I don't do that now, I was on the very, very front end of that podcast wave,
scene, yeah.
as much as, Blake Griffin in our favorite little video clip is like, I'm starting a podcast. I really think I got something to say, in the shit people say, LA people say. But I said, I need to do this. And I grabbed you. I said, what if we did a plastic surgery podcast together and did point counterpoint? And I think, it's interesting. Like, we don't have too many guests on here, and when we do, I think it goes okay. But I think this setup is our best venue for what we need to do with this podcast.
Well, yeah, because I think we're pretty good at getting the information in a sort of a distilled way out there, and that's actually so you were having your like podcast moment, and then on my side, I was having. All my friends, especially once I was actually in the plastic surgery space as a big girl plastic surgeon, they're always calling, texting, asking, well, what about this? Or what about that? Because my friends are kind of scattered across the country. And so they'd be texting me like, does this actually work? Or should I be doing this? Or what do we think about, vitamin infusions? And do I need to get microneedling? And what do you think about threading? And so I'm constantly like fielding these things. And they're like, oh, so that's just snake oil. Or, oh, that's not a thing. Or, oh, so that's just marketing. And one of my really good friends in Texas was like, you really should have a podcast, like where you can just tell people all the stuff that you tell me all the time. Because she's like, I have no idea. I have no idea if I'm being lied to. I have no idea if this is marketing, like garbage. And so you really should have a podcast just to like tell us normal people like what's what. And I was like, yeah, as if I would ever start a podcast. Like I have no time for that. And then you were doing your podcast thing and you said something about plastic surgery podcast. And I was like, yeah, my friend said I should start a plastic surgery podcast. What if? And I was like, I'm only going to do it if you do it. And you were like, well, I'm only going to do it if you do it.
Yeah, it's not. I didn't want to do it solo. That's for sure. This is a really and it's good that it's you and me because and I was listening to one of my favorite podcasts is Smartless, and it's Jason Bateman and Will Arnett and Sean Hayes. And Jimmy Kimmel was their guest. And they asked Jimmy for notes. And he was like, all right, I'll give you some notes. He goes, he says, first of all, I love when you guys pretend to use the products on your commercials. And they're like, no, we really do. Like, we're not sucking up here. He's like, no, I love the way that you guys pretend that you use it. That's one of my favorite things, how you bring it in and like try to bring it home for everybody. He goes, but I also don't think you need guests. He goes, I think I think the three of you, some of my favorite parts of the podcast is when the three of you just sit there and banter and talk to each other and go around and around. And I think for us, it's the same thing. I mean, our guests are effective when we choose them for what we need them to talk about or whatever. And I think we'll have more guests, going forward. But especially, that we have the studio space the way it is. We'll need to explore the studio space, just like Bruce Dickinson said. But that's that part where it's just you and I talking about plastic surgery items and concepts and how to do things and the post-ops. It really, I think it drives it home for the patients, and the prospective patients. And a lot of doctors who listen to this too are trying to learn aesthetic surgery. Residents don't know aesthetic surgery coming out of medical school.
Right.
They didn't have an aesthetic surgery course at Cornell University Medical College where I went to school. It was not on the radar screen. So by the time they get to their residency, they're learning just like anybody. Mm-hmm. And this brings it home for a lot of people. Yeah,
it's good. It's been great for patients. We try and dispel a lot of that social marketing stuff, like we mentioned earlier, and just give patients like the nitty-gritty, honest truth of what you need to know about plastic surgery. And it has been helpful, yes, for other plastic surgeons who are out there and listening as well. And I think it's just, I think it's been exactly what we set it up to be, which was just like an honest discussion about plastic surgery. And then because we started it, I mean, it was late in the podcast game, but still kind of early. This was like 2019. It was before lots of people had podcasts. And I remember talking about that with you and being like, at some point, podcasts are going to become like part of every plastic surgeon's, social media presence, how patients are going to get to know their plastic surgeon. And I think we are heading there. I think more plastic surgeons are definitely out doing their own podcast, getting their own voice and their own, truth out there to their prospective patients. So I do think that's happening a little bit too.
Yeah,
You seem dubious, skeptical.
Some more than others. I think the problem is that it's not easy to run a podcast. I don't think this is for everyone. I talked to some marketing guy when we were at IMCAS one year in Paris. That sounded very, very awesome for a second. When we were in Paris at an IMCAS meeting. And by the way, a lot of people go to those meetings.
Tons.
The last one, 15,000 participants.
Yeah,
That's
the next
a lot.
one, I can't even get a hotel room for 2024. It's already booked up.
I think I have mine already, so it's good.
Okay. All right. Well, one of
but
us
I'll
does.
see what we can. I'll see if we can. I'll talk to my people and see what we can do for you. But I think he asked me. He goes, he was about to go out on this panel. He goes, what has been like? He was like looking to like have me say something that he could take and go up on the panel with. And it didn't work out because he goes, what's been your most effective marketing tool? What is it that just grips your patients and gets them in the office to have surgery with you? And I go, it's my podcast. I said, the podcast I do with Dr. Rovelo is just a most honest, transparent, broken down. This is what the bare bones building blocks of plastic surgery are. So that when patients come in, they've already heard it, and they come in ready to have their questions answered, and they okay, I heard what you said, and he looked at me and is just like, wow. He goes, but that's like a show. That's like it's got entertainment value. It's got like that's hard. Is that hard? I was like, well, it's not hard for us because we just turn on the microphones and start talking. And they're like, well, who writes for you? I was like, we don't write.
I have gotten that before. Who are your writers?
Yeah, who are your writers? I'm like, me and Dr. Rovelo, that's our writers. Like, we just sit here and we're writing as we go. But that has been, really important to the practice because I think people, when they hear us kind of talking about it, they go, okay, I get it. Because we're not sitting here trying to sell anything. We're not trying to convince anybody to come in for surgery. We're just trying to provide information in a way that people can have a clear shot at what they need to know. And I think that's really effective, in terms of, getting people to know who we are. I think it's really effective because they just kind of hear it out of our mouths.
Yeah, it gives them the information they need. They kind of get a little bit of insight into who we are. They're like, oh, yeah, she's the dorky one that giggles and he's the confident, smooth one. Like, they get a sense of, like, who we are as people, and they either like us or they don't. If they like us, then they call and they listen. If not, then they leave a bad review.
They shut it off.
Please don't leave a bad review.
We actually do okay on the reviews. But, the truth is that I think that the future of podcasting, for practice like ours, I think it is a good idea. I mean, I think if you have if you got 3 or 4 people in a group, that's a great opportunity to do a podcast. I think, and it's not, I don't think the people that are, smartless listeners are going to listen to, the Beverly Hills Plastic Surgery podcast, but some of them might. And, I know that our topic is very niche. So like, we're not going to have, 3 million downloads per episode, but we'll have, 1,500 and we'll have, 4,000 or 5,000 a month of people listening who are trying to get information, trying to learn. And I think that's pretty great. I think that's been well worth it. I think our professional relationship to be able to work together and then to be able to talk about it here probably is why this goes the way that it goes. It's very smooth and we don't have to have writers. We don't have to have a script, which would then this isn't happening.
No. I mean, we do clinic and surgery all day on Wednesdays, and then we show up here and we talk, and that's about how that goes. But we have a great studio. We have a great producer, Mr. Sean Gosser. So
Sean, the man.
We have some
he's
help
our guy
for sure in the background here. But that was it. That was shout out to Kim. That was our podcast for her. How our meet cute story and how this podcast got together.
There you go. I think that's about all for going forward. Just expect a lot more.
Yes.
Well, actually, you know what? I'm going to change that. I'm going to go with the Jason Bateman on this one because he starts every live podcast. He goes, listen, the way that you're going to do well with us and have fun with this podcast is you can start by lowering your expectations. And he goes, that's going to make it easier for everyone. I think we're all going to be happier that way. So I hear him on that. But at the same time, I think people need to tune in and get some more info about plastic surgery. So for now, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.